Today, we delve into the topic shock. Before we start, let's freeze one master mnemonic EBBD. E. Empty tank, hypovolemic shock. B. Broken pump, cardiogenic shock. B. Blocked flow, obstructive shock. D. Dilated pipes, distributive shock. This is the whole chapter in one line. Let's go. Hypovolemic shock, empty tank. Think hemorrhage, vomiting, diarrhea, burns, dehydration. Hypovolemic shock happens when the intravascular volume falls, which lowers the venous return, ventricular filling, and the cardiac output. It is hemodynamically characterized by the low volume status, low cardiac output with increased SVR, and patient often looks pale, cool, and tachycardic. Memory line: hypovolemic is equal to no volume, no venous return, no output. Extra clue: low JVP, cold clammy patient, fluid loss or bleeding, hypovolemic shock. The low volume state is the key differentiator. Next, cardiogenic shock or the broken pump. Think acute MI, severe pump failure, major arrhythmias, myocarditis, valvular catastrophe. Cardiogenic shock is a primary cardiac disorder causing a low output state with end organ hypoperfusion. Acute myocardial infarction is the most common cause. It typically has decreased cardiac output, increased SVR, and raised filling pressures and raised JVP. Memory line: cardiogenic, heart is present, pressure is not. Exam clue: high JVP plus cold clammy skin plus chest pain or pulmonary edema, bad pump story, cardiogenic shock. Next, obstructive shock or the blocked flow. Think of the big three. Top. T. Tamponade. O. Obstruction by massive pulmonary effusion. P. Pneumothorax, tension. These are the classic obstructive causes repeatedly tested in MCQs. Massive pulmonary embolism obstructs the pulmonary circulation. Tension pneumothorax causes pressure buildup with mediastinal shift, and cardiac tamponade results from excessive pericardial fluid compressing the heart. Memory line: obstructive shock is equal to the heart may be okay, but blood can't move. Exam clue: shock plus sudden dyspnea or pleuritic story, think PE. Shock plus absent breath sounds or tracheal shift, think tension pneumothorax. Shock plus tamponade story, muffled heart, pericardial problem, think tamponade. Next, distributive shock or dilated pipes. Main exam causes: SAN, septic, anaphylactic, neurogenic. Distributive shock is a vasodilatory shock with low SVR. It includes septic, anaphylactic, and neurogenic shock. Early distributive shock can look warm rather than cold because of vasodilation. Memory line: distributive. Blood volume may be there, but the vessels are too wide. The single best differentiation trick: cold versus warm. Cold shock, usually think hypovolemic, cardiogenic. These commonly have cool, pale, clammy skin. Warm shock, usually think distributive, especially early sepsis or neurogenic shock. Neurogenic shock classically gives hypotension plus bradycardia plus warm or pink skin, and distributive shock overall is driven by vasodilation and low SVR. Mnemonic: cold is equal to empty tank or broken pump, warm is equal to wide pipes. The JVP trick students love: JVP low or high. Low JVP, think hypovolemic. High JVP, think cardiogenic, obstructive. Raised filling pressures are typical in cardiogenic shock, while hypovolemic shock is a low volume state. Memory lines: low neck veins, low volume. Full neck veins, pump or blockage problem. The neurogenic shock trap. This is the favorite examiner trap. Neurogenic shock, hypotension, bradycardia, warm pink skin. This is different from most other shocks where tachycardia is more common. Mnemonic: neurogenic is the odd one. Low BP, low pulse. Septic shock, must know examples. For adult septic shock, the Surviving Sepsis campaign recommends IV crystalloids first, at least 30 ml per kg in the first 3 hours for sepsis-induced hypoperfusion or septic shock. Initial MAP target 65 mm mercury. Non-epinephrine first line of vasopressor. Serial lactate and capillary refill time can help guide resuscitation. Antimicrobial should be started immediately, ideally within 1 hour once sepsis shock is recognized. Mnemonic: sepsis is equal to fluids, 65, non-epi plus antibiotics now. Anaphylaxis shock, one line answer. The first line treatment is IM adrenaline. Resuscitation Council guidance states that intramuscular adrenaline is the first line treatment for anaphylaxis. Mnemonic: anaphylaxis is equal to adrenaline first, fast, IM. 30-second exam algorithm. When you see shock in the MCQs, step 1, put it in one of the 4 boxes. Empty tank, broken pump, blocked flow, dilated pipes. Step 2, check the skin. Cold, hypovolemic or cardiogenic. Warm, distributive or neurogenic. Step 3, check the neck veins. Low JVP, hypovolemic. High JVP, cardiogenic or obstructive. Step 4, check the triggers. Bleeding, dehydration, burns, hypovolemic. MI, pump failure, cardiogenic. PE, tamponade, tension PTX, obstructive. Sepsis, anaphylaxis, spinal cord injury, distributive. The most useful mnemonics, type of shock, we've already discussed this. EBBD, empty tank, broken pump, blocked flow, dilated pipes. Obstructive causes, TOP, tamponade, obstruction by PE and pneumothorax tension. Distributive causes, SAN, septic, anaphylactic, neurogenic. Septic shock essentials, 30-65N, 30 ml per kg, MAP 65, non-epinephrine. Neurogenic shock, low pulse plus low BP. The best oral chant for revision. Yes, this time it's coming before the MCQ traps. Shock is 4 types: hypovolemic, cardiogenic, obstructive, distributive. Hypovolemic is empty tank, cardiogenic is broken pump, obstructive is top, tamponade, PE, tension pneumothorax. Distributive is SAN, septic, anaphylactic shock, neurogenic. Cold shock is equal to hypovolemic or cardiogenic. Warm shock is equal to distributive. Sepsis is equal to 30 ml kg, MAP 65, non-epinephrine. Anaphylaxis, IM adrenaline. Now comes the common MCQ traps. Trap number 1, thinking all shocks are tachycardic. Wrong. Neurogenic shock can present with bradycardia. Trap number 2, mixing cardiogenic and hypovolemic shock. Use JVP. Low is equal to hypovolemic, high is equal to cardiogenic or obstructive. Trap number 3, forgetting obstructive causes. Just remember TOP. Trap number 4, using the wrong vasopressor in septic shock MCQs. In adults, non-epinephrine is the first line. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.